Ooh. Hi guys, welcome to my channel. You already know who it is. My god, like this last few weeks hasn't been really easy for me. I just hope that my brain hasn't been the same, but I hope that this brain of mine will be able to sustain me for the rest of the year. Because my car kind of like gave up on me. Like really, it seems like everything is like giving up on me right now. And if I can just have control over one part of my life, I will be so grateful. Just one part. Just one part to the end of the year. That's all. But anyway, we're talking about the kidneys, okay? In order to really talk about the kidney, we need to know the functions of the kidneys. And the kidney, I don't know why, but I kind of confuse the functions of the kidney and the liver, and I think it has to do with the fact that the liver helps like kind of like take out ammonia, and the kidney kind of like excretes it as urea. So I guess that's why I kind of confused them. And you know, even the liver kind of helps with clotting, and the kidney also does it, but with erythropoietin. So I guess that's why I kind of confused them. But the main function of the kidney is to filter your blood. When I say filter, it kind of like strains things out. So when we're talking about when I say strain things out, it will take out excess electrolyte like sodium, potassium. It prevents like big substances from coming out, like red blood cells and proteins, that are not supposed to come out through your urine, unless inflammation, of course, or some sort of infection going on in the glomeruli, which we will talk about. The principal part of the kidney is like the unit is the nephron, but it has glomerulus, which helps filter your blood and take out the excess potassium, sodium, phosphorus, and prevents what we call uremic symptoms. Now that we have a basic understanding of what the kidney does, we'll move on to talk about like things that could go wrong in general for the kidneys, because pretty much the symptoms that you see for one condition is the same for the other in general, when there's a problem with the kidney. So what could happen is you could have increased hydrogen ions in your body, which is like pretty much your body becomes acidic due to the increased potassium levels in the body and stuff like that. So, and or increased carbon dioxide. So because your kidney is not getting rid of like all these substances. So for example, hyperkalemia is a problem. Like high potassium is a problem because it will cause dysrhythmias and eventually clots, and you know, all those things that we don't want to happen in the body. Hypermagnesemia, we don't want high magnesium in the body because it kind of goes with potassium. It will slow everything down. We'll have peak T waves on the EKG with high potassium. Hypocalcemia, because the kidney helps retain some calcium, but in this case, if there's high magnesium, there's low. If there's high phosphorus, there's low calcium. So we'll have hyperphosphatemia. We'll also have increased uremic or urea in the body, also called isothemia, where the kidney is not able to kind of get rid of or excrete like what's the word, substances that are not useful to the body from the ammonia, causing cognitive problems, nausea, vomiting, anorexia, and possibly a hypertensive crisis. So in general, your body is going to be very acidotic. So I will move into the labs. I'm going backwards because this is what happens in general with your kidneys anyway. So some of the labs that nurses look into is like BUN is just in general to check for hydration, and the normal levels is between 10 to 20, and we're gonna look at your creatinine levels in the body. And creatinine levels in the body is between creatinine kind of helps you tell if like, your body is excreting or is working or not working effectively. So if there's high creatinine, that means your kidneys are not working properly, or there might be too much protein for the kidneys to excrete or something like that. So normal creatinine level is 0.6 to 1.2. Then we have urine specific gravity, which kind of tells you, again, I think it has more to do with like hydration. It will be 10:10 to 10:20. Maybe like your body is retaining fluids, it's not coming out, and there's damage to the kidney, therefore the kidney is not able to excrete extra fluids or electrolytes. Okay, so that is I think I talked about. And there's something else called glomerular filtration rate, which is just like how fast your glomerulus is able to filter your blood. A good number is 90 and above, and below that is bad. A number such as 15 will give you an idea or tell you that your kidneys are not working at all. That will be end stage renal kidney disease, which is irreversible. Okay, so that's just what could go wrong, really. So now we're gonna go into like acute versus chronic conditions for the kidneys. So the first thing I would like to talk about is acute. An acute one will be something called, first of all, the stages. This is how acute is staged. There's the initiation phase where the kidney is just not working. Let's say there's oliguria, which means the patient is not voiding or the patient is not peeing enough, less than 30 mLs an hour. Or you could have a prerenal, which is where there's lack of blood flow to your kidneys. This could be due to shock. This could be due to hypertension. What else could cause this? So heart failure, pretty much anything that causes low blood flow to your kidneys. And then you have the interrenal phase, where it's due to things such as contrast dye, which is very nephrotoxic or really bad for your kidneys, or some medications such as cyclosporin. It is cyclosporin, something like that, which helps prevent rejection of transplants, of kidney transplants, or antibiotics like the mycin medications or NSAIDs. So anything directly affecting the kidneys. And then you have the post-renal, which has to do with some sort of obstruction, such as like kidney stones or a tumor or something like that. So then for acute, the condition is glomerulonephritis, which is also called, is it nephritic syndrome? Yeah, nephritic syndrome. Glomerulonephritis is usually caused by like some sort of like infection. Is it? Yes, an infection, like a viral infection like strep or impetigo. Well, with this, usually 2 weeks after the infection, usually the patient will come and say, well, 2 weeks ago I had like a strep throat, or I had like an impetigo, like, you know, like a rash on the arm, and all of a sudden I'm seeing blood in my urine, you know. So you want to think this is acute renal failure. So some signs and symptoms will be water retention, which might lead to hypertension or high blood pressure. Facial like puffiness due to the the water retention. We might see some protein in the urine, some blood in the urine, again due to the fact that the glomeruli, which is the filtration part of the kidney, is inflamed. Therefore it is leaking those big substances such as red blood cells and protein. So yeah, we might also see something called isotemia, which is retention of urea, which we really don't want because it might lead to what we talked about earlier, uremic symptoms. Okay, so that is that for acute. renal disease. And the other thing to know about this is that it is reversible. And some of the important medications to know that might cause this, like I talked about earlier, you have NSAIDs, like I hope it's aspirin, aminoglycosides, gentamicins, cyclosporins that help prevent rejection, the dye, contrast dye that you put to visualize, let's say, the kidney or whatever, amphotericin, which is an antifungal medication, or ACE inhibitors, which we'll use to prevent or to decrease hypertension, to prevent chronic renal failure. So that is all for really acute renal failure. So now we'll talk about chronic renal failure. And a big example is nephrotic syndrome. Nephrotic syndrome, usually when you see nephrotic, think of the O. There's high amounts of protein that is being dumped out into your urine. And a big example of this is albumin. This is especially important because albumin helps regulate oncotic pressure, which means it helps keep the fluids out from your cellular area into your vascular area. So when that happens, for example, like if that happens, we'll have edema, and this is exactly what happens then, because there's loss of albumin. Your body is retaining lots of fluids, but it is not in the vascular space. It is more so in your interstitial space. So we'll see puffiness all over the body. We'll see hypertension. We'll see protein in the urine. I already talked about that. We'll see maybe a foamy urine, whereas the acute one, which was glomerulonephritis, we'll see like tea-colored urine. So that's really that for nephrotic syndrome, which is a chronic condition. So the other chronic conditions that we might talk about when it comes to the kidney is cancer. Cancer of the kidney can be very dangerous because there isn't like any symptoms, like it's not painful, but you might see some blood in your urine and you think, oh, whatever, it's not a big deal, I'm not feeling sick, you might have a little bit like of a flank pain, but I think when you start having those symptoms, it's kind of too late. And the people that are at risk are like male patients, or patients that smoke. So that's really all I have for cancer. And the other chronic condition is a genetic condition called polycystic kidney disease. It's usually seen in young patients. They'll have polyuria, or they will be urinating a lot. They might have renal calculi. Renal calculi, the stones. It's very, it progresses really fast, and they'll eventually need a renal transplant. And I will talk about end-stage renal kidney disease before I talk about the transplants. So you also have something called end-stage renal failure, which is a chronic condition where your filtration rate is at 15. Glomerular filtration rate is at 15. There's nothing you can do about this. It's irreversible. You have all the signs and symptoms of the chronic conditions, plus the acute, which is hematuria or blood in your urine, and flank pain, and you might have some Kussmaul's breathing towards the end, because your body's fighting to get rid of the hydrogen ions in the body, or the acidity in the body. So that is really that for the chronic conditions. So then, because the polycystic kidney disease, there's no cure, plus the end-stage renal disease or the cancer, there's no cure. So what we'll do is we can do the best thing to do really is the renal transplant, but it's not really like kidneys are not available all the time. So we're gonna do or propose dialysis, or dialysis, and there are many types of dialysis. We can do a peritoneal dialysis or a hemodialysis. A peritoneal a peritoneal dialysis is when they pretty much put some fluids. Usually you want to warm the fluids. It's a hypertonic solution. I hope I'm correct about that. I have to check. But they put it inside your stomach. The fluid should be clear and all that, so you put it in there, you warm it, you put it in there. The thing to watch out for is like a hernia, because you're putting pressure into your peritoneal area. You want to watch out for trouble breathing because it's in the diaphragm area. You want to watch out for infection or sepsis. So you want to use a septic technique to do this. Wash your hands, make sure everything is clean around the area. You also want to watch out for weight gain, because these things that we put usually is high in sugar, so it can cause like weight gain and things like that. So I think that is really that for peritoneal. So yeah, you want to watch out for the color of it, watch out for infection, watch out for a hernia. Then you have a hemodialysis that you can do. You can do an AV shunt, which is when you connect the atrial to the venous area on your hand. It will help filter your blood. It will act as a kidney with a machine, an outside machine to filter your blood. The shunt is not going to be used right away, so it's going to have to mature over 3 months. And while over the 3 months, you're going to have to like kind of be doing some arm exercises. Make sure not to take any blood pressure on that arm. Make sure to put a sign at home or whatever that nobody's to take blood pressure on that arm or take any sort of blood draws or anything like that. But in the meantime, they'll do a vascular access. They can do it in the jugular area, the subclavian area, or they can do it at the femoral area. So they will do that. And what was I gonna say? Yeah, so that's what they'll do until the AV shunt is mature. Another thing is, if they're not able to like do the AV shunt because let's say the vein is not good or whatever, they might do an AV graft, which still works the same, but it will put an extra kind of like graft in there, whether human or animal, to bypass and help with the filtration of the kidneys. Another thing that they can do is like is it a CCRT? Okay, vascular access. I thought I had it, guys. I don't see it anymore, but yeah, something like a CCRT. If none of those work for acute kidney injury, where they'll have a machine that would just help like kind of filter. If it's for acute, acute, they'll use a CCRT. Usually it's by a nurse who is specially trained for that. When it comes to the AV shunt, again, you want to check to feel the thrill, making sure there's still blood flowing there and everything is good. I think it's feel the thrill. All I wrote is feel the thrill. And yeah, and another big thing about this hemodialysis is you never want to give hypotensive medications before you do this, because first of all, the machine kind of like, when you do this hemodialysis, it causes hypotension. So if you give medication, it's going to cause further hypotension. You don't want to do that. Okay, so the third thing we can do is, if none of these things work, we can go ahead and do a renal transplant. I mean, a renal transplant is actually better. It's more economical, as in you don't have to go and do dialysis every day, but it's rare. But with the transplant, you want to make sure to take your medications at the same time every day. Like, don't skip it, else your body might reject it. And so you want to watch out for infections. If you're taking these meds, you want to check your kidneys regularly, because this cyclosporins is cyclosporins is also nephrotoxic, as in it is toxic to the nephrons of your kidneys. What else? Again, if you have like hypertension, you want to manage your hypertension with ACE inhibitors, which also can be nephrotoxic. which is an antihypertensive medication. So that is that really for, and also with the transplant, if it is rejected within 24 hours, we definitely want to take that out right away, because that is a mismatch. But if it's subacute, like after 10 days, we just want to maybe give more meds and stuff to decrease your immune system to prevent the rejection. So now when it comes to nursing care of the patients, we can make sure to keep the skin okay, because they're going to have this froth from urea on the skin, because the kidney is not able to get rid of these things. So we're going to have to reposition the patients every 2 hours. Again, most of these patients might have pulmonary edema, like water retention, due to the fact that the kidneys are not working, usually there's heart failure that causes this. So we want to make sure that the patient is breathing properly. We want to watch out for ionos, daily weights, check the skin, making sure that the nails are cut short, or they can wear like some gloves to make sure that they don't hurt themselves. Nutrition, we want to make sure they don't take too much, they don't take a lot of proteins, even fluids. They might be on fluid restriction or sodium restriction, so that they will not be retaining fluids. Also, they might have to limit potassium or high phosphorus foods or high magnesium foods, like things like canned sodas, or bananas. We already know bananas, but like oranges and dry fruits and vegetables, they want to avoid those type of things. Also, since they're on fluid restrictions, we want to make sure the mouth is always clean, because it can cause pneumonia, first of all. Second of all, we want to prevent them from drinking too much fluids, and which will go back to fluid overload and things like that. So ice chips is best. And if they have, we want to also put in a telemetry on to check the heart due to the hyperkalemia, just to make sure that they're not having like a VTAC going on, which is ventricular tachycardia, which might lead to a blood clot, and then and maybe a stroke or something like that. We don't want that an occlusion to the body. And that is really all I have for this video. I hope I covered everything, and it's probably 30 minutes long. I'm sorry. So that is it really. So I talked about trauma, infection, watching out for shock, serial urinalysis, and PO, and alright, so that is it. Those are the most important things about the kidney. I hope you like my video. Thanks for watching. Bye.